Ashley, how are you today?
Hi, good. How are you?
I'm good, thank you. Do you mind if I come in and talk to you for a little while?
Yeah, I'm feeling pretty tired,
You're
but I
feeling
think it'll be okay.
Alright, well good. Just let me know if you get too tired. My name's Danielle. I'm from occupational therapy.
What is that?
Oh, well perfect. I was just going to ask if you knew what that was. As an OT, what I would do is help you get back to the things that you were doing prior to your injury.
That would be awesome.
Well, good. That's what I'm here for, and I want to help you be as independent as possible. So what are some things that you did, before your accident?
I love to plant, and I just love to be with my kids and run around outside with them. I know that I won't be able to do that anymore, but I really loved planting. If I could maybe get back to doing that.
Awesome. Yeah, well that's something that I would definitely be able to work on with you and help you find different ways to do those things that you love. How many kids do you have?
I have 2 kids. They're 5 and 4.
Oh wow, that's a good age. They're probably exhausting, huh?
Yeah, they're really exhausting.
Well, I can imagine. I have some kids of my own. So hopefully what we can do is help you be able to, play with them like you used to and get back to gardening. So what I want to do first today, though, if you're up for it, is to do some, it's called a preparatory method, and it's going to help prepare you to do an activity or an occupation. And more specifically, what I want to do is a type of therapeutic exercise, and we would work on some range of motion, and that's just, moving your arms and your joints through all of their motion. So would you be able to show me what movements you can do right now?
Yeah, I can bring my arms up and touch my shoulders.
Good.
I can also bring my shoulders, up to my ears.
Good.
I can bend my wrists down, but I can't really get them back up.
Okay.
So.
Well, that's very normal for the level of injury. You had a C6 spinal cord injury, and those are normal movements to still have. So that's good, and those are good movements. Good things to have that'll help you later on when we're trying to do other types of activities.
Good to know.
Yeah, you can
Thank you.
Oh, sure. You can use those shoulder muscles and things to help support you. And today we're just going to do the range of motion, like I said. But maybe next time I come in and see you, we'll work on some strengthening of those muscles so that you really have some power behind those movements.
Yeah. Okay. Cool.
Good. So, are you up for me to do some passive range of motion on you and see how far I can get your limbs to move?
Sure.
All right. So if you don't mind, my hands are a little cold. I'm going to warm them up for you so they're not too cold.
Yeah, it's pretty cold out there today.
Cold. It's getting a little warmer. Do you want me to open the blinds for you so you can see what a nice day we're having?
That'd be really nice.
Awesome.
Yeah.
It's actually one of the first nice days that we've had in a really long time. The sun's shining, sky's blue.
Yeah.
Maybe next week if you want, we can, if it's warm enough, if it's not raining, we can go outside and do some of these things. And get some fresh air. So what I want to do is, like I said, just try and bring your limbs through the motions and see what I can, what they're capable of. Because it's really important for you to be doing some range of motion every day because you want to prevent something called contractures. And I don't know, has anybody told you about those yet?
No.
Well, what happens is if you're in a position for too long, your muscles kind of shorten, and then your arm is kind of, permanently, or whatever part of the body is kind of permanently in that position. So we want to prevent that from happening. It's super simple to do. All you have to do is, keep up with these range of motion exercises. You want to be consistent with them. So if you don't mind, I'm going to take your arm here, and you said you were able to do that. So I'm just going to bring that out, bring your arm down. Good. So you're unable to bring it fully down like that.
Yeah.
I'm going to turn your arm this way. And you can you can extend your wrist, correct?
Yep.
Okay, bring it back like that. Forward. Good. Come over and do the same thing to your other arm. Up and touch your shoulders. And down all the way. Good.
I like your nails. They're very pretty.
Oh, thank you. I like to do that not that I have a lot of spare time, but when I do, I like to paint my nails. Maybe we could work on that one. We could come in and paint your nails for you. do now is kind of bring your arm out to the side. Just bring it up. Down. Let's bring it over here again. And bring it all the way up. If you're reaching for something on the top shelf. Oh, it might be sitting too close to the window over here. Right. Bring it up. And all the way up again. That's just really getting your limbs through their full range. So do you mind if I were to take this blanket off? I just want to kind of do some of the same things with your legs, if that's okay.
Yeah, that's okay.
Alright, just get this out of the way so I can see what I'm doing. Got you all tucked in here.
Yeah. Is today Sunday?
Today is Sunday.
Okay.
Is anybody coming in to see you? Am I going to run into any little kids running around?
I think my kids might be coming in later.
Awesome. Do you have boys or girls?
They're 2 girls.
2 girls.
Yeah.
That's me and my sister. They're about the same age. That I'm just going to take your leg and just kind of bring it up and bring it back down again.
Okay.
Stretch it out. Alright, so those were the range of motion exercises that I wanted to do with you. And again, it's important to just keep up with those and prevent those contractures from forming. So now what I want to talk about is some education and training for you to prevent any skin breakdown. So when somebody has sensory loss, that's going to cause an increased risk of skin breakdown. So because you can't feel the pressure. Okay. So sensory.
I can't breathe.
So what I wanted to do next was go over some techniques, do some education and training on skin breakdown. So somebody with sensory loss is not going to be able to, you're going to have an increased risk of developing sensory or skin breakdown, because since you aren't able to feel those parts of your body, you're not going to feel the pressure like you might have before. And some signs to pay attention to are redness, and you might not be able to see that because it's going to be more towards the back that'll happen. But
I could have my husband help me out.
Yeah, exactly. You want to utilize him as much as possible, and I'm sure he'll be more than willing to help you with that. And it's the personnel here is going to know to check for that, but it's still important for you to know. Be like, okay, well maybe we can check. Make sure that I'm not getting any pressure sores. So it's just always good to advocate for yourself. So
how many times should I do that a day?
It's good to do it about 30, maybe every 30 to 60 minutes, just to make sure.
Okay.
Yeah, and the areas that you're really gonna feel that on is the bony areas of your body. So maybe your elbows or the backs of your heels, and the bottom of your spinal cord, which is your tailbone, and maybe the bottom parts of your butt, where it's if anybody ever told you had a bony butt when you were little.
Yeah.
I know my mom always used to tell me that. So those are the areas that you're going to want to watch for.
Okay.
And there's a lot of things that you can do to prevent that from happening. You can do position changes frequently. You can get like a padded seat cushion.
Oh, that might help.
Yeah, and that would be more comfortable for you too.
Yeah.
So I can talk to somebody about getting that for you, or I can even go look after this and see if I can find a really good padded cushion for you. So one of the positions that you can do, I'll show you, and then I'm not going to have you do it right now, but you can we can work on that next week. So you're going to want to bring your shoulders down and forward. It's called shoulder depression and protraction. And then you're going to want to externally rotate your shoulders. So that'll just happen. You're going to have your elbows locked like this, and then your shoulder is just kind of going to externally rotate. And you're going to have your wrists extended, which you do have that movement. And you're just going to, like I said, you're going to lock those elbows, and you're just going to lean forward, and that's just going to take the pressure off of that back area. And you want to do this for maybe 30 seconds to a minute. And it's really important that when you're doing that, you have somebody sitting in front of you or next to you. So, like, you never want to do it unattended. So you can have somebody sitting in front of you like this, just making sure that just in case you lose your balance, you're not going to fall forward, or have somebody on the side of you, just making sure that, you're not going to fall over. And again, your husband can help you with that, or I can help you when I'm here, and the nurses and everything. So
would you be able to explain that to him too when he comes back?
Yeah, I'll definitely. When he comes back from his coffee break, we'll redo the range of motion techniques with him, and I'll teach him how to do that. And then, like I said, you'll know, so you'll be able to educate him too when it's just you two, and I'll show him how to do all those different positioning techniques and things to prevent any skin breakdown.
Okay, that would be awesome.
Good. I'm glad
Thank you.
Oh, no problem. I'm glad I was able to help today, and I really enjoyed working with you. So just keep some of those things in mind, and then when I come back next week, we'll talk about how it went and what you liked, what you didn't like, and maybe start the strengthening and move towards your goal of playing with your kids and getting back outside gardening. So
thank you.
You're welcome. It was nice working with you, and I will see you next week.
All right.
Alrighty.